as one county health department in Wisconsin accused the retail giant of not allowing them access to a facility after dozens came down with the virus. Our Deirdre Bosa following that story this evening. She joins us live from out on the West Coast. Deirdre.
Hey, Scott. So Amazon doesn't actually disclose or release its infection data, but unofficial tallies put the total number of cases at warehouses at about 900. Meanwhile, lawmakers and public health authorities, they're requesting more information about cases and conditions from Amazon. So right now, this is all playing out in Kenosha, Wisconsin, where health officials say that Amazon is not cooperating with them to track cases at its campus there. Local reports put the number of COVID cases at the Amazon facility at more than 30, and they say that health officials are considering attempting to actually shut down the campus, and that would be among the most extreme action that authorities have taken against the company on workplace concerns. Now, Amazon would not confirm the number of cases to us and said that it, quote, welcomed a visit from the Kenosha County Health Department. Over the last few months, though, Scott, labor unrest has been rising among not only the company's warehouse workers, but it's also reaching its white-collar employees. They're all demanding more protection amid the pandemic. And calls from lawmakers are rising for more transparency. In mid-May, a group of 13 attorneys general called on the company to disclose more infection data. Finally, Scott, I should note, though, that Amazon's biggest rival in the retail space, that's Walmart, does not disclose its own data about coronavirus cases. Amazon, though, happens to be big tech, and we know that this is a sector that is getting close scrutiny from lawmakers. Back to you.
Deirdre, appreciate it. Dee Bosa reporting for us tonight. Okay, Dr. Gottlieb, you're a former public health official. Do health officials need more access into these warehouses, and should these companies be more transparent about the number of cases they're seeing?
Well, look, they're going to demand it because a lot of these facilities where you have at-risk employees working in close contact with each other, in many cases without protective equipment, those become the focal points for outbreaks within communities. So public health officials are going to start demanding this, and businesses need to think about how they do contact tracing in the workplace and how they prevent outbreaks. They're not going to be able to prevent a single case from getting introduced into the work site. What they can prevent in the work site, if they have good oversight, is an outbreak in the work site. What they're trying to do is reduce the likelihood that a single introduction is going to lead to an outbreak of more than, and pick your number, 3 cases, 4 cases, by a certain percent. And they're able to do that. You can actually model that and figure out how much risk reduction you can get from different measures you can take, including potentially testing employees on a regular basis.
Our Twitter questions are back by popular demand, Dr. Gottlieb. I'm going to run through a few for you again this evening. Morris Franco wanting to know, is there an issue with distancing in swimming pools? He's clearly thinking about the Memorial Day weekend, as all of us are.
Lower risk. This is a respiratory pathogen. It's not going to be spread through swimming pools like some other pathogens are.
Have another question. Could we please get Dr. Gottlieb's thoughts on transmission on various surfaces, such as glass, touch screens, metal, wooden door handles, knobs, etc.?
The CDC came out and said that they think a lot of the spread is through respiratory pathogens and sustained exposure to people who are infected, less on surface spread. I think there's still a risk to surface spread. Different surfaces have different risks. So cardboard, certain metals are lower risk than others. Glass, lower risk than metal. Copper is the lowest risk of the metals. And so I think it's still prudent to try to clean shared surfaces. But the CDC has said that they think that that's much less of a risk than first perceived during this outbreak.
Final question for you tonight from Nick Spalding. Is it necessary to wear masks outdoors? We've been talking, Dr. Gottlieb, obviously, about a lot of outdoor activities. Says he's asking for joggers and walkers and those screaming at both to wear masks.
Well, look, it's become part of social etiquette, too, so we need to factor that in. Outdoor activity is lower risk. So I think as the summer starts, I think we should try to move as much activity outdoors as possible. You know, if you're in a circle of people that you trust, people are going to make decisions not to wear masks in those settings. I think generally we should be trying to wear masks out, at least as we start to enter the summer and try to understand how much of this is spreading into the summer, whether prevalence is really coming down.